Hello, everyone, and welcome to the 2021 Refugee Week webinar hosted by New South Wales Health Service. My name is Mahnoz Anguri, and I will be your MC for the day. With this year's theme of unity in mind, this webinar is called the Keeping It Together During COVID-19. We are so fortunate to have some amazing speakers joining us today, so we do hope you enjoy today's talks and learn from everyone's experiences. Before we begin, I would of course like to acknowledge the traditional owners of the land that we're meeting on today and remind people that we are on Aboriginal land. I also acknowledge and pay my respects to the Aboriginal elders past and present and extend that respect to the Aboriginal people here today. Just some housekeeping, attendees won't be able to unmute during the talks. However, a Q&A opportunity is also scheduled if time permits. So please use the Q&A option at the bottom of your screen to submit any questions you may have. Well, life since COVID-19 has become unpredictable for all. It's during times like this that we realize how important it is to stay together and be united. I actually started my journalism career at the very beginning of COVID. Of course, working in news, I wasn't part of the group that worked from home or didn't work at all. I went to the office every day and read and reported on the constant ups and downs, mostly downs, of the year and a half that's passed us. The only constant I had was going home to my family. Of course, a lot of our conversations were still COVID related, but having family all together was something I always looked forward to. Our life with COVID is far from over, but looking back, we can still appreciate that this time of our lives has taught us a great deal about the volatility of life and in turn shaped us into stronger individuals and, more importantly, a stronger community. Today, we have members of the Refugee Health Network of Australia who will be presenting. Each presenter will have around 10 minutes to speak. We also have presentations from states who could not be with us online today. Now, between presentations, we have videos from community members sharing their stories on keeping it together during COVID-19. To follow, we are fortunate to have with us today Dr. Elizabeth Conroy from the University of Western Sydney to summarise common themes and learnings from today. Now, to start off, New South Wales Refugee Health Service reached out to the community members to ask, how are you keeping it together and staying united with your community and your family during COVID-19? What are the challenges? What have you learned? And has there been any positives? Today, we'll be viewing a number of videos from a range of community members. These videos will be made available on the New South Wales Refugee Health Service website and local health district YouTube channel. Here's the first video.
مساعدة الناس لبعضهم بعض كانت من خلال فترة الكورونا، كان من خلال شغلتين. الأول شغلة كانت هي من خلال تبادل المعلومات واللي صادرة عن الهيئات الصحية. هاي النقطة الأولى. النقطة الثانية بالنسبة كانت هي الالتزام بهالشيء. الالتزام بهالشيء حد كتير من الإصابات. يعني بالنسبة للشيء الإيجابي خلال هالفترة مع العيلة، إنك أنت زادت الوقت اللي قضيته مع عيلتك. اكتشفت أشياء كانت نتيجة ظروف الحياة الطبيعية، إنك أنت غفلان عنها ومانك شايفة. بهالفترة تعززت الروابط. اكتشفت نعمل جروبات لتطوير بعض المهارات في مسائل اللي بتفيدنا بحياتنا العملية. بالنسبة لاتصالي مع مجتمع الخارج أستراليا، شيء مهم وأساسي بالنسبة لي، لأنه هذا أنا المجتمع جزء من حياتي ومن بيعطيني راحة ودعم نفسي. لذلك كان الاتصال جدا ضروري. هالشيء بيعطيني دعم نفسي وراحة جسدية. يعني لما بكون نفسيتي مرتاحة بيأثر علي كجسديا، إنه بيعطيني نشاط وحافز للاستمرار. يعني هالشيء كان جدا ضروري. وكان في عامل تاني هو وجود بلد حقق نتائج ممتازة في مجال الكورونا. يعني كانت نسبة الإصابات الحمد لله بأستراليا متدنية. لذلك أنا يعني أمر كان جدا مريح لي ولعائلتي إنه وجدنا ضمن مجتمع عملوا بجميع الوسائل والطرق للحفاظ على الناس. يعني الأخبار كانت ممتازة، النتائج اللي كانت وسائل الحماية كانت متاحة متوفرة بجميع الأماكن، والالتزام من الناس كان رائع. يعني كان الالتزام من الناس، يعني بتلاحظ مع تخفيف القيود بعض الأحيان الناس لساتها ملتزمة بالدرجة الأعلى لحماية نفسها وحماية الآخرين. أنت لما عم تحمي نفسك عم تحمي كمان الناس الآخرين المحيطين فيك والمجتمع ككل. بقى كانت الأمور ممتازة بالنسبة لي. نعم. أسوأ شيء كان خلال فترة الوباء هو شعورك أنك أنت عم تتعامل مع شيء مجهول، لا شيء جديد ظهر، لا معروف أسبابه، لا معروف علاجه، لا معروف طريق. يعني كانت طريقة التعامل إنه بالقيود هي الطريقة الوحيدة لسلامتك. أنت في حالة خوف على نفسك، على عائلتك، أفراد أسرتك، على مجتمعك المحيط فيه.
Well, it's now time for our first speaker, who's from WA, Dr. Ethan Thembiran. Dr. Thembiran is a GP and Medical Director of the Humanitarian Entrant Health Service in Perth, Western Australia. He's a founding member of the RIANA and past chair of the RACGP Refugee Health Special Interest Group. After 16 years, Ethan is stepping down from the Humanitarian Entrant Health Service, but will continue to provide clinical services to his clients from refugee backgrounds in his general practice, as well as working with refugee rights groups in Perth.
Can you hear me?
Yes.
Okay.
Go ahead.
Thank you, Manaz. Firstly, I'd like to also acknowledge the traditional owners on the land where I'm seated, the Whadjuk people of the Noongar Nation, and pay my respects to their elders past, present, and emerging. As Manaz mentioned, I work at the Humanitarian Entrant Health Service, which is a specialist public health program which provides holistic health assessment for all humanitarian entrants who settle in WA. We're located in the Perth Central Business District at the Anita Clayton Centre, and the service is part of the Public Health Unit, which sits under the broader North Metropolitan Health Service. Our service model is based on 2 visits. The first visit with a nurse who conducts a structured interview with on-site interpreters, and the second visit about 10 days later with a GP who completes the medical assessment and management plan. So looking back over the last 12 to 18 months, the start of 2020 was like most years at HES, as the team prepared to receive humanitarian entrants referred to Australia from the UNHCR. However, as infections with the novel coronavirus surged around the globe, the World Health Organization declared a global pandemic on the 11th of March 2020. And subsequently, the Commonwealth closed Australia's international borders on the 20th of March. And this restricted the arrival of humanitarian entrants, which had a huge impact on all our services. Between January to the beginning of April 2020, we still managed to see some clients, and during this time we assessed 197 humanitarian entrants. However, with the reduced refugee arrivals, the HES medical and nursing staff were redeployed to other roles within public health to assist with Western Australia's response to COVID-19. And for my team, this involved working with the COVID Public Health Operations Team, or FOPS, assisting with contact tracing and follow-up of positive COVID cases. This was a period of intense activity with many staff working in a new and challenging environment to ensure the safety of all Western Australians. And it was a steep learning curve for all our staff, as little was known about the virus and new evidence was emerging almost daily. HES staff proved to be very flexible, adaptable, and team-focused during this uncertain time. I'd like to share with you my personal experience of working with a family from a core background while I was assigned to the Public Health Operations team. A few weeks after I joined, we had a notification that a middle-aged man, who I'll call Mr. T, had tested positive for COVID-19. He was a man in his 40s from a refugee-like background who had been admitted to hospital with a respiratory illness and subsequently tested positive to COVID-19. The history emerged that he was a rideshare driver for a couple of rideshare companies. And in his household were his wife, his two primary school-aged children, and his mother-in-law. The man and his wife spoke some English, but his mother didn't have any English. Mr. T had a number of chronic illnesses, which slowed his recovery from COVID-19, and he was eventually discharged from hospital after about 2 weeks. Unfortunately, Mrs. T also tested positive for COVID-19 during this time. She worked in the aged care sector and provided in-home care to several elderly clients. Given our experience of working with refugees, the HES GPs were tasked to be involved in the follow-up of this family. Our main task was to ring them each day to check on their symptoms and ensure they were appropriately isolating at home. Fortunately, with our skills, we were able to demonstrate to the generalist public health nurses, many of whom had recently joined health as part of the surge workforce, how to book and work with telephone interpreters. Many had not done this before. Mr. T and his family were from an ethnic minority with a history of persecution in his home country. The police and other government officers in that country were well known to intimidate people from his community. And I was very conscious that this family may be suspicious or wary of government agencies in Australia ringing them up every day to try and check on them. So it was really important for us to ensure that our phone calls were delivered in a non-threatening and friendly manner, and we hope that they weren't perceived as us being authoritarian to them. Unfortunately, or fortunately, perhaps, during this time, WA police were also doing spot checks on positive cases to ensure they're in home isolation, and sometimes turning up at night time to check that everyone was at home. So we tried to reassure the family that the police checks were about their welfare and not about any form of punishment. We also worked hard with Mr. and Mrs. T's employees to get the lists of their contacts and keep their employment open during the period of isolation. We also had to liaise with the children's schools. Fortunately, their children and the grandmother did not acquire the infection, and I think this was testament to them following the public health advice and appropriately isolating at home. Sadly, though, word got out into the community that the family had COVID-19 and were in isolation. And unfortunately, they were shunned by some members of the community. Mr. T had been a prominent person in his community and led a community organisation, and he felt very personally let down by his community and the fact that he'd been stigmatised. And this just added to the trauma of him having COVID-19 and having to self-isolate. Fortunately, though, his GP was from the same language group, and we were able to work with the GP to help support the family and re-establish links with their community. I tell this story because I think it serves as an example to identify a number of issues with COVID-19 in the community. There are, of course, the obvious linguistic and cultural barriers. There are the challenges for public health staff as well when engaging with vulnerable communities to do so in a non-threatening and caring way so that these individuals don't feel suspicious or wary of government agencies. There is often misunderstanding and stigma within the communities when someone tests positive, and it's important to ensure that those individuals are well supported. The case also highlights the extremely precarious employment circumstances of many migrants and people from refugee work backgrounds who are working in the so-called gig economy, who may have multiple jobs, multiple employers, and working across multiple sites. And I think the COVID-19 has really exposed lots of gaps in our workforce or support of our workforce. It was also important for us to liaise with schools, employers, and the police. And finally, it highlights the importance of teamwork and sharing our knowledge as refugee health professionals with our colleagues across other sectors. Our current challenge, of course, is around increasing our rates of immunisation. I have personally already encountered a number of myths circulating from my clients in the migrant and refugee community about the COVID vaccine, including fears about infertility in young women. These have been misconceptions amongst new arrivals and also established communities, which kind of surprised me. So all of us working in healthcare, be it refugee-specific or mainstream services, need to keep building on the unity of working together during the pandemic as we move forward to ensure that no one, no matter where you were born, which language you speak, or where you live in Australia, is left behind by our COVID vaccination program. Thank you.
Thank you so much, Dr. Asen. Thank you for your time and thank you for joining us today. Now, representatives from Queensland are unable to join us today, but they have kindly sent 2 videos that tell us some of the work they've been doing in response to COVID-19. Vicky Jacobson, the Refugee Health Network Queensland Coordinator, and Grace Edward, the CALD COVID Health Engagement Project Coordinator, outline how the network responded with communities across Queensland during COVID in 2020 and how the CALD COVID Health Engagement Project is being rolled out this year to ensure all Queenslanders, regardless of their background and their language proficiency, have equitable access to appropriate health information and services.
Yep. Hi, I'm Vicky from the Refugee Health Network Queensland. Last year during the pandemic, we found ourselves right in the middle between health services, settlement providers and other key multicultural community services and community members. We worked with all of those partners in a collaborative way, mostly informally, but as we grew stronger and our partnerships grew more deeply, we realised that actually a formal partnership is what we needed to be able to meet the needs of community and build the capacity of services. So we worked together on a partnership initiative that Queensland Health is now funding, and Grace is one of those project workers.
Hi, my name is Grace and I am one of those project workers, and what we also realised is that a lot of our CALD community members and leaders had already been doing the work that has informed this project. So what we wanted to do is to be better placed to support that work and help those leaders continue the work that they've been doing in a more sustainable way. So that means using existing networks to pass on information 19 and make community leaders, whether formal or the right information to be able to pass on to their communities.
Right, so our next speaker is Maria Fauteng, who is one of the Matter Refugee Health Advisory Group members, a group of 11 refugee health consultants known as the G11. She will talk about her role during the pandemic, including translating and creating audios about changing restrictions and sharing these messages via social media. Some of these messages were even shared globally.
I mean, what did you know? What did you difficult? Any of that? Any of
Is with you.
Yeah, I mean, what did you do as part of your role with the Mater, or what did your community do? What worked well? What was difficult? Any of that?
At the Mater here, I've got two titles. The Refugee Health Consultant, that is with you and Ali and everybody. And my other job is in the nursing, a casual home. So I've got two hats here. And because I'm a very connected person in the community, the way we got the messages to the community from Queensland Health, and then of course through the Mater, actually kept the community in touch with the messaging. The audio that we used to do were really, really helpful because lots of the community, not lots, but some of the community members don't actually read and write, and it's just hard to just get everything in English as the news. So when they audio the messages, then they could listen, and knowing that this is Maria's voice, it gave them kind of, oh yeah, this is Maria, she got this for us, and they would listen to it, and they listen to the messages. Not myself just alone was doing the messages. We had also a community leader called Double, who also used to do that for the community. So it was the combination of both that actually worked very well. One of my messages was shared by a community member, and actually that ended up in Canada, and I ended up getting contacted. Oh Maria, this is really good, this is really nice, and I felt like, wow, this is good. It's not just helping Australia, but again, it can help anyone that speaks my language in another part of the world.
Great. Can you just tell me a bit more about those? Like, what kind of messages were you?
They were the COVID messages. They were how to social distance when the lockdown was really hard, how you could have how many numbers in the house as visitors or family members, not family members, but the visitors, when it was really the lockdown, when we didn't have to travel around and go places. So when anything was updated, we could then send the messages to the community so they know. Still, they used to hear from the news and everything, but again, it was just an immediate message that comes from your.
Our next speaker is Dr. Tony Maldari. Dr. Maldari is the Senior Doctor at Refugee Health Service in Adelaide.
Thanks, Manaz. So Refugee Health Service is a state-funded service in Adelaide for new arrival refugees and asylum seekers. I do have with me three of our bicultural workers as well who are listening in to the webinar. So I guess similar to Ethan, we started off 2020 sort of thinking about all the new arrivals we would be getting and what the year would hold. We didn't anticipate anything like what 2020 turned into. Our response to COVID, I guess, was similar to what happened across the nation. You know, every day we were getting new information and having to make changes within our clinic in response to that information. We moved to telehealth like most of Australia did, so that, and I think that was good in that it helped us stay connected with our patients. We could keep providing a clinical service and also provide lots of education to the community and try and help reduce a lot of the fear in the community. And I think it would be fair to say that most of our patients were very good at staying home and keeping their families safe. Although a lot of people, after a while, found telehealth, well, they didn't like telehealth. They preferred to come into the clinic. And I guess that reflects the importance of having that sort of face-to-face social connection with people, and just the fact that, you know, someone else is in the room has a big impact on their mental health and psychosocial well-being, I think. And I guess the other aspect of telehealth was working with phone interpreters was, I think, very tiring and time-consuming, but we just got on with it and did it. I think South Australia was quite lucky. We had quite low COVID numbers. We were one of the first states, we were the first state to introduce drive-through testing. We started testing for COVID very early in the pandemic, and SA Health, I think, started testing all respiratory samples very early. And they had lots of equipment stored in their warehouse waiting for a pandemic, apparently, so we're able to respond very quickly to the need for lots of testing. I think our Chief Public Health Officer connected with the community very early and you know, communicated very well with the community, and this worked particularly well with the Afghan community. I think when there was an outbreak, and that led to about 100 young people going into hotel quarantine, and I think almost 1,000 people going into home quarantine. So, I mean, the next challenge, I think, is we're seeing lots of respiratory illnesses, lots of people coming in with colds and flus. The messaging last year was, you know, if you've got a cold, you've got to stay home, you've got to get a COVID test, but that message seems to have been forgotten now. So we're trying to get that message out again, that it is still really important to be testing for COVID. We've started a COVID vaccine clinic recently. Interestingly, there's been lots of probably not unexpected, lots of hesitation about the COVID vaccination. So we're doing some community capacity building to try and build trust and give people some good information. So as part of that, STARS, which is our torture trauma service, worked with the Bhutanese community and developed a video, which I think we're going to show a bit of, to try and educate people about COVID and provide good information about COVID vaccination. And it seems to have made a good impact, with lots of Bhutanese people wanting to get vaccinated and you know, making appointments and getting on with that. So perhaps we can start the video. Thank you.
नमस्ते सम्पूर्ण भुटानी समुदायका सदस्यहरुमा म लालबहादुर राई वर्तमान बासाको चेयरपर्सन आज म तपाईहरुलाई कोरोना भाइरस अथवा कोभिड-19 सम्बन्धित केही जानकारी दिन गइराखेको छु। अहिलेको अवस्थामा हेर्ने हो भने हामी लगायत सम्पूर्ण सरकारहरुको प्रयासमा कोरोना भाइरस केही मात्रामा हटेको छ, तर पनि अझै पूर्ण रूपमा हटिन सकेको कारणले गर्दा यो जुनै बेला पनि फर्केर आउन सक्छ र त्यस कारणले अझै पनि
खै त दशैं मानेर जान्छ भन्थ्यो कोरोना, अझै 2-3 वटा दशैं मानेर जाला जस्तै छ। यसले पनि हैरानै पार्ने भयो। घाँटी दुख्यो भने, टाउको दुख्यो भने, ज्वरो आयो भने घरमै बस्नु पर्छ रे। आज बुढाबुढीको भेलामा नि जानै पाइन।
हाम्रो आमालाई धेरै कुरा थाहा रहेछ त। सास फेर्न साह्रो पर्दाखेरि, खानाको स्वाद नपाउँदाखेरि कोभिड-19 लाग्न सकेको हुन्छ अरे।
ए छोरा, कति बेला जाने डाक्टरकोमा चाहिँ?
हिजो मात्रै कोभिडको टेस्ट गरेको थियो। अहिलेसम्म रिजल्ट आएको छैन। रिजल्ट आएपछि डाक्टरकोमा एपोइन्टमेन्ट बनाएर जाउँ न त। यसलाई यसरी देखाउनुपर्छ।
आमा तपाईलाई यो क्यूआर कोड स्क्यान गर्न समस्या भयो यही त्यसो भने तपाईले आफ्नो नाम मोबाइल नम्बर र आएको समय पनि यसमा दर्ता गर्न सक्नुहुन्छ।
मलाई नेपाली त लेख्न आउँदैन इङ्ग्लिस त मर्छु।
ठिकै छ त म लेखिदिम तपाईलाई। अनि तपाईलाई थाहा छ यो स्क्यान या दर्ता गर्न अनिवार्य छ नि?
यो कन्ट्याक्ट ट्रेसिङ भनेको के हो सर?
यो कोभिड-19 महामारीको रोकथाम गर्ने तरिका हो।
राम्ररी सुन्नु है।
तपाईलाई यो स्क्यान या दर्ता गरेको जानकारी स्वास्थ्य विभागमा पुग्छ। मानौँ यहाँ आएको कसैलाई कोभिड-19 भएको पत्ता लाग्यो त्यस बेला यहाँ आएको सबैलाई सम्पर्क गरेर कोभिड-19 को जाँच गराउन र आइसोलेसन बस्न लगाउनका कन्ट्याक्ट ट्रेसिङ तरिकाले धेरै राम्रो काम गर्छ।
नि यो गर्दा त आफूलाई फाइदा हुँदो रहेछ।
ठिकै छ बस्दै गर्नु होला डाक्टरले तपाईको पालो आएपछि भित्र लानुहुन्छ।
Thank you for that, Dr. Tony. Before we move on, I would just like to remind everyone that if you have any questions for the speakers, please use the Q&A option to submit your questions and we'll try to get to them during the Q&A session at the end. We now have another community member from New South Wales, Yusuf, sharing his story on staying united, healthy and connected during COVID-19.
الحقيقة هو كوفيد-19 تحدي كبير للإنسان، ولكن دائما الإنسان عنده استجابات وردود أفعال ويستخرج من باطنه طاقات كثيرة لمواجهة هذا الوباء. فعلا الناس ظهرت عندهم خصائص إنسانية ممتازة. بعض الناس ساعدوا بعض ما نعرف بالجانب المادي خاصة لمن ترك العمل. بعض الناس ساعدوا أناس آخرين عن طريق التبضع أو التسوق لمن كانوا يعجزون عن النزول. فالحقيقة هذا التعاون الإنساني أنا برأيي هو كان رد فعل لهذا التحدي لظاهرة كورونا. إضافة إلى ذلك لاحظت أنه الناس صار عندهم تعاطف attachment مع الآخر أكثر، يعني يرفع تليفون يسأل عنه يوميا. وهذه وسائل التواصل الاجتماعي حقيقة خلقت فد تعويض عن اللقاء فيس تو فيس مباشرة، وكانت الناس تتواصل بشكل كبير عن طريق وسائل التواصل الاجتماعي وتسأل عن بعضها. يعني أولا كان عندي شعار stay home، بقيت في البيت لما ما يكون هناك ضرورة للخروج. لكن بالتأكيد أنا يعني عندي علاقات اجتماعية وعندي متابعة للمكتبة وأسافر بوسائط النقل، فكنت أضطر أطلع. التزمت بثلاث أشياء. أولا السانيتايزر موجود بجيبي دائما، وهذا هو لحد الآن أنا أحمل السانيتايزر. ثانيا لبس الماسك، وهذا مهم جدا. ثالثا السوشيال ديستانس الحقيقة مع الآخرين. يعني عندنا مثل يقول رب ضارة نافعة، فوجود العائلة اضطرارا بسبب كورونا حتى اللي يعملون أصبحوا في البيت الآباء والأبناء. أعتقد صار تقارب بيناتهم، واحد افتهم الآخر. الزوج شاف أتعاب الزوجة بالبيت وربما بدأ يعاون الزوجة لأن عنده وقت فراغ. الأبناء بدأوا يعاونون أيضا الأب والأم واقتربوا من بعضهم، وهذه فرصة كبيرة أن يتريقون سوية، يتغدون سوية ويتعشون سوية. هذا اللقاء الحميمي الجميل بين أفراد العائلة ما كان موجود سابقا، فهذه فرصة للقاء والتفاهم وأيضا التعاون اللي حصل بين أفراد العائلة. هذا كان فد شيء ممتاز الحقيقة. يعني الإنسان دائما يريد أن يكون حر فري متحرر. الذي حصل في جائحة كورونا صار تقييد على الإنسان، تقييد في خروجه من البيت، تقييد في حركته، تقييد في لبس الكمامات، تقييدات كثيرة. فهذا التقييد للحرية هو مضايق للإنسان، والإنسان ما يريد أن يكون مقيد بهذه الطريقة. الزيارات تقيدت، العلاقات الاجتماعية تقيدت، حركة العمل تقيدت، حركتك أنت في باص النقل تقيدت. وهذا أكيد ما يزعج الإنسان، ولكن الإنسان أقول عنده قدرة على التكيف، الأدابتيشن، يتأقلم يتكيف مع هذه الظروف لفترة معينة على ما تعبر عاصفة كورونا، وباء كورونا، وحين ذاك الإنسان يبدأ يرجع إلى حريته الطبيعية ويتصرف بشكل طبيعي.
Now, next up is Professor Christine Phillips. Unfortunately, Christine is a bit unwell, but she has sent some slides which we will go through. Professor Phillips is a general practitioner with 25 years of clinical experience. She is the Medical Director of Companion House Medical Services, the ACT's Refugee Health Service. She is the immediate past chair of the Refugee Health Network of Australia and has been an advisor for the World Health Organization, UNHCR, the Migration Council of Australia, and state and federal departments of health and human services on refugee healthcare. Marisha Salem, who is the Deputy Director of the New South Wales Refugee Health Service, will be presenting on her behalf.
And of course, my slides are not here. No, they are. Just bear with me, please, for a second. Okay, over to you, Tegan, if you don't mind helping me with those slides. Oh, great, now we've got it. Great. Good morning, everyone. My name is Marisha Salem. I'm one of the 2 Deputy Directors in New South Wales, working in New South Wales Refugee Health Service. Thank you for your patience with our technical difficulties. So Dr. Christine Phillips has kindly provided me with some notes on this slideshow to show you, and we'll just go ahead with it. So I'll just speak on behalf of Christine, so I'll read her notes exactly as they were sent to me. I'm presenting today on the experiences of COVID Companion House Medical Service, the ACT's Refugee Health Service. I'm opening with this picture of the ACT's main COVID testing site at the showgrounds of the northern outskirts of Canberra. You can see that it's a busy drive-through service. You can't use it if you're not in a car. There are other testing services for walk-ins, but they're not easy to access through public transport. So one of the first things we established was that we had to be able to offer testing in addition to our regular service. The second thing we learned early, as everyone did in our sector, was that refugees were disproportionately represented among essential workers. They work in aged care, disability support, nursing, cleaning, security, hard work, ward work, managing the testing clinics. While others were going into lockdown, they carried the responsibility of continuing the essential work of the community, often articulated, as Martin says, out of a sense of moral duty. This is from a short film we have released for Refugee Week, and I'll give you a link at the end of this talk. The third thing we did was to stay open and tell our community that we were staying open. Many general practices shut over the lockdown or only did remote care. We needed to stay open. In fact, we changed just about everything that we were doing. We worked with only a skeleton staff of doctors, nurses and case managers, with the counsellors and other key staff all working from home. We reworked our entire clinic environment so that we could safely examine people who might have been exposed or had COVID symptoms or had travelled from a COVID hotspot. The fourth thing we did was to increase support for housing and for those facing hopelessness and destitution. Canberra has the worst housing affordability in the country. Asylum seekers in particular often found that they lost their accommodation and in addition had no income support to last them through the lockdown. This slide shows our food bank, which together with the housing support collaborative with Red Cross became an important part of our response to COVID. So what have we learned? The mainstream COVID public health response is often insufficiently aware of the people who would fall through the cracks. The lockdown was very hard for asylum seekers who faced destitution. It was also hard for large families living in quite crowded homes, having to manage homeschooling, especially if they had insufficient IT resources. It was hard for people with chronic or complex diseases who don't stop being sick, even if there is a national lockdown. It was hard for people who realised that their own communities were going to be introduced in the media or subject to specific lockdowns. Though I want to stress that the ACT government and media did not do that. As we speak, her colleagues at Companion House are running COVID vaccination clinic. We hope that we will be able to ensure that refugee communities have the same or better levels of protection as others. As I close now with a link to our recently released film on Canberra's essential workers from refugee background, we thank them all. Tegan, are you happy to play the first 50 seconds if you don't mind?
It's very important to contribute something when we have some situation like this.
What kept me motivated is just to focus on what is matter to us right now and where I can be most useful and effective. Yeah, that's what kept me motivated.
Because I feel like we are under sort of the national crisis, that everybody have a role to play. And I felt that time that this is the time that my country need me most.
For me, like I feel really happy that I'm kind of like helping them during this pandemic.
Thank you, everyone.
Thank you, Marissa, and thank you to Dr. Phillips. It's now time for our next video from another member of the New South Wales RENAC who will share her story with us.
أثناء فترة الكوفيد الشيء الوحيد اللي كان يخلينا نتواصل مع بعض ومع عائلتي اللي هون ومع أهلي ومع أصدقائي إنه إحنا عملنا جروب على الواتساب وكنا نتواصل مع بعض ونبادل الهموم والمشاكل مثل ما يقولون. اللي ساعدني على البقاء متعافية خلال فترة كوفيد إنه أنا اتبعت جميع التعليمات اللي كانت تعطيها الحكومة عن طريق التلفزيون وعن طريق وسائل التواصل الاجتماعي، إنه باستعمال الماسك لما نطلع من البيت والمحافظة على التباعد الاجتماعي بيناتنا وكنا نغسل إيدينا أول ما نفوت على البيت. الشيء الثاني إنه إحنا كنا نزيد ناكل أكل صحي، ناكل فواكه وخضروات كثير حتى تزيد المناعة عنا، ونبتعد عن الأشياء اللي تعملنا يعني تأثر علينا، لأنه فترة الكوفيد تعرف إنه أنت كان أكو كله بقاء بالبيت ماكو حركة كثير، فنبتعد عن الدهنيات وعن الشغلات السكريات الكثيرة ونركز على الفواكه والخضروات أكثر بالأكل. أهمية الاتصال مع العائلة والأصدقاء اللي خارج أستراليا كثير مهمة بالنسبة لي. أول شيء حتى نفسيا أرتاح وأكون مطمئنة عليهم إنه هي بأمان ما فيهم شيء. ودائما أحاول أشرح لهم إنه كيف إحنا نتبع التعليمات، إنه هم لازم يمشون على هاي التعليمات كلها، وإنه الكوفيد هو شيء مؤذي، إنه لأنه دائما أغلب الناس خارج أستراليا كانوا يعتقدون إنه الكوفيد إنه هو خاصة من البلد اللي إجينا إحنا من عنده، إنه الكوفيد لا شيء ما يأثر عليهم نهائيا، عندهم هاي الفكرة الخاطئة. فإحنا كنا نوصل لهم فكرة إنه هو لا، مرض خطير يأثر عليهم، لازم يهتمون بنفسهم خاصة الكبار السن اللي بالعمر. ومن ناحية ثانية إنه أنا أعتبر نفسي إنه أنا كثير محظوظة إنه أنا بأستراليا، لأنه أستراليا بلد كثير يهتم بالشعب ويهتم بصحتهم. نعم تعلمت كثير أشياء. أول شيء تعلمته هو الصبر، لأنه قبل أنا ما كنت كثير صبورة وكنت أريد كل شيء يصير على السريع، بس حاليا بعد فترة الكورونا صرت صبورة كثير. كل شيء يجي بالوقت المناسب. تعلمت كثير شغلات عن أولادي، تعلمت كيف أتعامل معاهم، تعلمت كثير شغلات عن مهارات أولادي قبل ما كان عندي وقت إنه أنا أقعد وأحكي معاهم أشوف كل واحد هي اهتماماته إيش هي. كذلك تعلمت إنه مجرد شيء بسيط صغير بالعالم لا يرى بالعين المجردة يمكن يوقف الإنسان عند حده ويوقف الحياة بشكل كامل.
Now, our next speaker is Dr. Mitchell Smith, who is a public health physician and has been involved in the healthcare of refugees for 25 years, both overseas and in Australia. Since 1999, he's been the director of the New South Wales Refugee Health Service. The service undertakes health assessments, health education, teaching and research regarding people of refugee backgrounds living in New South Wales. He has conjoined appointments at the University of New South Wales and the University of Sydney. Dr. Smith provides advice on refugee health policy at local, state, national and international levels. In his spare time, he's taken on additional roles in the management of COVID-19. Now, Dr. Smith will first share the work undertaken by the Tasmanian Health Service, North Refugee Health, based in Launceston. Unfortunately, they could not attend, but did send some slides. He will then go on to describe the work undertaken by the New South Wales Refugee Health Service. So, Dr. Smith.
Thanks, Monez. I'd like to start by acknowledging the traditional owners of the land from where I'm speaking today, which is the Capable clan of the Darug Nation, and pay my respects to their elders past, present and emerging. I'll share my screen, and Monez, you can just let me know or confirm that the Tasmanian PowerPoint shows.
Yep, I see it.
Excellent, thank you. So I believe that's a picture of Cradle Lake, which is next to the wonderful Cradle Mountain in northern Tasmania. So my colleagues Janelle and Susan from there weren't able to be here, as Monez said, but they just wanted to share a few thoughts with you about what's been different for them in recent times. So interestingly, they've had a small number of individuals still arriving to reunite with spouses, mainly through the Humanitarian settlement program. And what's different perhaps to the rest of the country is that the largest group of persons arriving in northern Tasmania were from Eritrea. And you'll see there that they've had others arriving from Bhutan, Afghanistan, Ethiopia, and Chin State in Myanmar. So average of 30 people per month before the border closure. So it's not insignificant numbers. And you'll see there how there's a difference between the profile of people arriving to northern Tasmania, i.e. Launceston, with that large number of Eritrean people, and then smaller numbers to the Hobart region, with a focus mainly on the Ethiopians. So in terms of reaching out to communities during COVID, obviously COVID stricter rules around hospitals meant that because their clinics located in a hospital setting, there were less drop-ins. So that was an additional barrier to their communities seeking health support. They did, however, continue their face-to-face support where possible, working within those restrictions, and that included some creative adaptations, which was things such as booking larger spaces in rooms for people to congregate in, some opportunistic interventions, and still doing outreach, including home visits when required to avoid those restrictions in the health setting. They've developed some in-language resources to support communities with English as a second language, particularly in northern Tasmania. And their social work team has been heavily involved in that health promotion and continuing to focus on community development within their communities there. We all know that the vaccination rollout has posed and continues to pose some challenges, and that's no different for the team in Tasmania. They've noted a lack of language support at various points, and so they're continuing advocacy on that to ensure that stakeholders and others across Tasmania are well informed and supporting those who need vaccinating, and they're using bicultural workers to improve that uptake. In terms of what they feel has worked, some of the models of care that they feel have been influenced, they no longer have a refugee medical service per se, and it's more a GP-based model. And whilst that existing GP services have continued primary care for people of refugee background, they feel that capacity is lacking, and so they feel that that's a barrier to good care there. They have, of course, like others, increased telehealth options, improved connectivity to specialist care for those who are in geographically more distant locations. But as we all know, there are some technological barriers to access for particularly our refugee community people and the technical challenges that they face. So as a team in northern Tasmania, they've managed by flexibility to support each other, sharing of resources and knowledge, interdisciplinary consultation for those who needed support, and they have a multidisciplinary team down there, particularly nursing and social work, and also opportunistic care and interventions such that hospital visits were minimised. So that's from our friends in northern Tasmania, and thanks to Janelle and Susan for providing those slides for us today. So I'm now switching to my New South Wales hat and telling you something about what we've done here, particularly in Sydney with the Refugee Health Service in terms of in the last 18 months or so. I guess it's fair to say that there's been a very uneven impact on our services, and whilst some of them have seen a continued much the same in terms of their workloads, some have decreased, whereas others have actually increased in workloads, particularly due to the psychosocial and financial impacts of COVID-19, and particularly on asylum seekers living in the community. A number of our staff have been redeployed, and so we have a large number of nurses that work with us, and so a large number of them have been sent to work giving influenza vaccinations, now COVID vaccinations. Prior to that, they were working in testing clinics around Sydney. So that's been a big change for them, and they've had to be very adaptable. Then certain of our teams, such as our asylum seeker team, we have a disability support team, their work has not only remained the same, but actually increased. We've had a new occupational therapist join us in recent times, which has been excellent, working particularly with that disability support team. And that's been a welcome addition. Our health promotion programs have continued, albeit with a different methodology often, much more online programs. And there's been a switch, of course, towards focusing on education around COVID-19, both precautions in terms of prevention, but also now on the benefits of vaccination. And that's a challenge for us all to get those messages across, given the concerns that exist in the communities, not just refugee communities. We have, luckily, we're very lucky to have 2 social workers in our team, and they've been extraordinarily busy with referrals becoming more and more complex, people with chronic disease, undermanaged, but very complex psychosocial issues as well. Unfortunately, we've seen what appears to be an increase in, or at least in reporting of, things such as domestic violence, some child protection issues, suicidal ideation, and homelessness. So they've been really busy facing those issues. As a service, lots of innovation needed, plenty of flexibility, thinking outside the square, learning new ways of working. And like Yusuf on our video, I loved him talking about hand sanitizer. And so we've had our own hand sanitizers here, which we're very proud of. That's been an innovation. With more staff working at home, we've done daily huddles over the net to keep people in contact, using unofficial WhatsApp groups to keep staff connected, that sort of thing, which has just germinated. Formed partnerships with NGOs, other statewide health services to keep everybody contact and communicating. We've also had significant input to media and communications for our diverse communities in New South Wales about COVID-19, and that input continues. Our bilingual community educators have been trained in COVID-specific knowledge. They've recorded video messages, done radio interviews in language. They've also helped support the COVID testing and now the vaccination clinics, which is great. So they've got a lot to add to their CVs. And they and other staff have done a lot of online training resources, provided information session, answered Q&As, helped ensure that local businesses are COVID safe so they don't get fined, and a number of things like that. We've prepared for the future by converting out some of our health information into videos, and they'll be able to be viewed by people who arrive when the borders reopen, either in quarantine or in their homes. Our clinical work has continued, and whilst much of it has been done online, we've tried to keep some of it face-to-face where it was safe to do so, particularly for those high needs groups that we see. We know that asylum seekers have been most impacted, especially those who've lost support through the SRSS reduction. As I inferred earlier, there's been some crisis management, and we've even had staff have had to deal with even at least one client suicide in recent times, which has been very challenging for them. And as I mentioned, the deployment of staff means that everyone's had to adapt and face new challenges. So the battle with COVID-19 continues. The last few days in Sydney shows that very well. We'll await the eventual reopening of borders and hope that we can keep holding it together then. Thanks very much.
Thank you for that, Dr. Smith. Now, just to pull together today's themes and summarize the key points, Dr. Elizabeth Conroy, who's a Senior Research Fellow at the Translational Health Research Institute and conducts research in the area of homelessness, trauma, and substance use. Currently, she's partnering with the JRS on a project exploring the homelessness and housing experiences of people seeking asylum in Sydney. Dr. Conroy is also a registered psychologist with previous experience providing trauma counselling to people seeking asylum. She chairs the Psychology and Refugee Interest Group in Australia in the Australian Psychological Society.
Thank you very much. Hello, everybody. What a delight to hear such optimistic stories about how we all came together through COVID. I think sharing these stories is so important for us at this stage, given how unpredictable things are with the pandemic, and we're still working our way through this. So it's so important at this time to be reflecting on how we've grown as a community over the last 18 months. Things are not back to normal, and while here in Australia we're faring a little better than some other places, so many of our community members continue to be impacted. Much of my time as high degree research director at my research institute is bearing witness to some of the fears, but also the sadness experienced by some of our students who've lost family back home, or who can't be with family during significant events like the birth of their first child, or feeling helpless about being here in Australia when they've got family elsewhere. I think the stories that we've heard from our refugee community today and the services that work with them really highlight how resilient and creative humanity can be. And I hope that we can carry some of these lessons forward with us. So these are some of the lessons that I'm taking forward with me. The first is gratitude and appreciation for the small things, because we all slowed down, becoming more patient with life, prioritizing what was important to us, being grateful about being in a country that was able to keep COVID infections much lower than experienced elsewhere, but remembering the experience of others whose lives were not so easy. Focusing on what matters, our purpose, who needs us and what we can contribute. COVID really rallied us, and our refugee communities were at the forefront of this, especially given their roles as essential workers. We need to broadcast this more loudly and celebrate the often hidden roles that keep everything going for the rest of us. Second, the importance of sharing information with others and the willingness of people to step up and be the link between one system and another, or between different community groups. Many of these messages were shared via video through social media. These seem to have worked well, but I wonder about the challenge we still have to make sure everybody in our community has access to this medium. The internet has become critical to issues of equity, access to information, to education, to support services. Telehealth and other modes of service delivery are likely here to stay, but as mentioned by some presenters today, it doesn't replace the need for staying connected with each other in person. We also heard how individuals shared health information with family and friends overseas. Australia has such an important role in sharing our knowledge and resources with communities around the world, including sharing vaccinations and medicines with countries that don't have the same capacity to purchase these themselves. The generosity of sharing what we have has so many positive flow-on effects. I know for myself, I need to do better sharing the knowledge and information generated through the research that I do. Often the focus is on generating information and less emphasis on sharing it. I think today's stories really demonstrated how important that was, and how perhaps maybe not so easy, but how doable it is. Third, the importance of staying connected with each other. Taking the time to reach out to others, whether that be our family, friends, neighbours or community. There seemed to be such an instinctive response in a lot of the stories told today. At the service level, it was about keeping services open and reimagining service delivery through different mediums, or strengthening collaborations and partnerships to fill gaps and to ensure no one was left out. It shows us what we can achieve when we come together to address an issue. It would be so amazing if we could achieve the same rapid responses to tackle other social problems like homelessness and family violence. Hearing from Companion House in the ACT and from Mitchell Smith in New South Wales about the support that they provided to people seeking asylum in relation to housing, family violence and other issues. I think this is such important work. I'm currently working with the Jesuit Refugee Services in New South Wales on a project looking at housing for people seeking asylum, and our findings echo the experiences of Companion House and the Refugee Service in New South Wales, highlighting how COVID has exposed the vulnerabilities and inequities in some of our support systems. And we need to continue our work to address these for the different communities we work with. And finally, perhaps the most significant for many of us, COVID strengthened families. We all spent more time at home, and some of the speakers today highlighted how important family was for their well-being, and the increased understanding of each other that came from spending more time together, learning more about our children, our partners, appreciating what our family members do for us, and learning new skills from each other. I really hope that we can continue that focus and also be there for some of those families where perhaps being together was not such a happy time. So those were I guess the key learnings that I took. I've gone through those quite quickly. I just want to leave enough time for people to ask questions, because what we heard from today was so, I guess, inspiring about how, despite everything that we've been to, how interconnected we all are and how we can rally to come together and support each other in the work that we do. So thank you very much.
Thank you for that, Dr. Conroy. Now we'll view our last two videos for the day, showcasing more stories of unity within our community.
multicultural health services stay united because we had the support of each other. We had the support from team members, team leaders, and manager.
We evolved to be more flexible in our service, obviously, to our clients, such as doing a lot of Zoom meetings, a lot of PEC-SIP calls and telephone calls to check in on our clients. As colleagues, we try to jazz it up by having what you call a dress-up day on, like a colour dress-up day on Thursday to liven up the mood a bit. And that's been kind of really uplifting and team building for our organisation. Everyone focuses on mental health because it's the lockdowns and it's the isolations that is really impacting on a lot of people. And a lot of people cope by reaching out to family members through innovative ways. So my mum would call me quite more frequent than usual, and I would call her to check in on her as well. We needed to protect her, so we did lots of Zoom calls, which was really interesting because she's not technologically advanced. The whole family kind of chatting in on a certain time and on Sunday.
Always keep in contact with your community, with your families, call everyone, make sure you can do video calls or Zoom calls. Also, stay healthy, eat healthy.
It made people focus more on their family and what really, really matters in life. Because in the end, when you got death on your door, it's family that counts. Family is everything.
Great. Well, that was all the videos, but we are reaching the end of our webinar. Before we wrap up, we do have time for a question or two. So if you have any questions, please type it in the Q&A little section down at the bottom of your screen now. Now, so I did want to ask Dr. Smith, you know, working in New South Wales Health, you obviously are aware that there is a lot of, vaccine hesitancy, especially within the community where English is their second language. Do you think enough is being done to send out accurate information to this community so that we decrease this vaccine hesitancy?
That's a great question, Manas, and I didn't even ask you to pose it. So, well,
yeah, I was thinking about it while you were speaking.
Are we doing enough? We're trying to do enough, both locally at state level and at national level. Some would say there's almost too much information out there, and it's overwhelming because there is so much, including information that's been translated into multiple languages, and we're forever getting emails with material in 63 languages in New South Wales, which is great, but it does become a bit overwhelming. And of course, the concerns about these vaccines are community-wide, and so it's a difficult mountain to climb, but I would hope that everyone listening to this webinar can get on board with the fact that, you know, the way to keep our communities safe, the way for us to be able to have friends and family over when we want, the way for us to be able to visit our family and friends that live overseas is going to be for us to be vaccinated against COVID-19. And the same applies when we want to have our friends and family visit us from overseas. They're going to need to be vaccinated, and we here are going to want to be vaccinated to make sure we're all safe. So it's really important. There's a lot of information that one can read on different websites, and I know that's not accessible, but you know, social media, radio, television, all sorts of different avenues are being used. Community leaders around the country, there's various national groups looking at COVID-19 information for our CAL communities, which is really important. So, I think that's great, and I think the Commonwealth Government is actually doing its best to get messages out there as far as they can.
Thank you for that. One of our attendees is wondering if anyone can give some information about the processing of humanitarian visas offshore when we're likely to see refugees arriving.
Well, if anyone knows the answer to that question, can you let us all know? that's going to be that's a difficult one. I'll start. Somebody else might have some thoughts. The last figure I heard was potentially 8,000 people have been issued with refugee program visas who are waiting offshore. So Gordana, we have no indication of when when the borders might reopen to those groups. I would hope that when we start talking about international students coming back into Australia, that the needs of those from refugee background would be considered at the same time. It's going to depend on our quarantine facilities, of course, and we're going to need a lot of those. We might need some alternative ways of quarantining people. Again, I think as vaccination spreads, things will get easier. I'm also asked, will people of refugee background be required to have a COVID vaccine before they come to Australia? I don't know, but I would have thought yes. But that's just my personal opinion.
Right, well, I understand there is one final video to be played. So can I please have that put up, please?
For me, it's important to talk with my family and with my friends overseas to teaching them what the new rules in Australia to be in good healthy about COVID-19. I give for him more advice what the new is from the government in Australia. During COVID, this time is teaching me to take my long time to improve my language, where they use YouTube and study in my home. My kids, they help me how is spelling the words, and now I'm seeing myself. It's good now and having good. Learning how it's saving money here, everything, I think, because I use my time when I stay at home. I have more things positive in this time. The first thing is my daughter, when she finished study online, she hear the music new thing, and now she's play guitar. Now she study music and talking with my kids, and maybe they teaching me how to read story for my little daughter, and they help me how cooking. They know something from my culture is cooking special dishes. That's a good time. In Arabic, they say is when your family is close, they have more is warm, and that time is, believe me, is too close. And outside, I know it's COVID-19 is bad thing, but when you stay with your family is good thing to teaching together and know what they thinking, your kids, especially for moms. And COVID-19 actually he do that all the family closer together.
Now, we have pretty much reached the end of our webinar. Before we finish up, Marissa and the management team of New South Wales Refugee Health Service want to acknowledge and thank the Refugee Week Working Group on the wonderful efforts made by all. Special thanks to Lisa Atkins, Eloise Lecomte, Lydia Sestakova, Mel Galanto, and Elaine Ochoa for your tireless efforts. We wouldn't have been able to do this in the short time frame without you. You are wonderful, as are B. Ann, Danielle, Daniela and Jana, all who made this event as special as it is. Thank you also to the Ingham team who facilitated this event, Tegan and Ellie. And of course, thank you again to the speakers and to all the attendees. I hope you all enjoyed today's events and learned something from all of our speakers' experiences. That's all the time we have. I hope you guys have a great rest of the day.
And Manas, thank you to you for hosting today. It was a pleasure to have you, and thanks for putting yourself out for this time. It was terrific. And I'd like to acknowledge my team as well in Refugee Health Service, Marissa and her team for organising an excellent event. And thanks to Elizabeth and all the speakers from other states and territories. Thanks, Manas.
Thank you. Thank you, guys.